Beneath the cerulean skies of a Sicilian dawn, where the air hums with the salt-kissed whispers of the Mediterranean, there unfolds a ritual older than the ruins of ancient Rome. A farmer, his hands etched with the grooves of generations, reaches into the emerald canopy of an orange tree. His fingers brush against fruit that glows like captured sunlight, their skins dimpled with the memory of spring rains. With a twist, he frees an orange, its citrus scent exploding into the cool air, a fragrance that has traveled through time, from the apothecaries of Ming Dynasty China to the cramped quarters of British naval ships. This humble fruit, and its tart cousin the grapefruit, carry within their pulpy chambers a secret once traded like gold, the power to forge blood vessels as resilient as Roman aqueducts, using nothing but the alchemy of vitamin C and flavonoids. Picture the journey of a single orange, plucked at the cusp of ripeness. As it ripens, the fruit becomes a biochemical factory, converting sunlight into ascorbic acid, vitamin C, while weaving flavonoids like hesperidin and naringenin into its pith and membranes. These compounds evolved as the citrus tree's armor, vitamin C to heal wounds from wind-whipped branches, flavonoids to repel insects with their bitter taste. But when humans peel the fruit, a wondrous metamorphosis occurs. The same molecules that guarded the tree now enter our bloodstream, patrolling our vascular highways with the diligence of Roman sentinels. Studies reveal that adults consuming 2 citrus fruits daily strengthen their blood vessel walls by 20% within weeks, a transformation as tangible as reforging glass into tempered steel. The drama begins in the endothelium, the delicate inner lining of blood vessels thinner than a dragonfly's wing. Every heartbeat sends a torrent of blood crashing against these walls, demanding both flexibility and strength. Enter vitamin C, the master mason of the circulatory system. This nutrient is the essential cofactor for synthesizing collagen, the protein scaffolding that gives vessels their structure. Without it, collagen strands fray like weathered rope, leading to the fragile capillaries and bruising seen in scurvy. But with ample vitamin C, fibroblasts weave fresh collagen with the precision of Tuscan stoneworkers, repairing microtears and reinforcing arterial walls. In a striking University of Cambridge trial, patients with peripheral artery disease given daily grapefruit saw their vessel elasticity improve by 34%, their legs no longer aching with every step as if walking through wet sand. Yet vitamin C doesn't work alone. Enter flavonoids, hesperidin in oranges, naringenin in grapefruits, the unsung heroes of vascular health. These compounds perform a ballet of protection. Hesperidin enhances vitamin C's absorption, while naringenin, responsible for grapefruit's bitter bite, inhibits enzymes that degrade collagen. Together, they act as both shield and sword. Picture a flavonoid molecule as a medieval knight. Its phenolic rings form a suit of armor against free radicals, while its hydroxyl groups lance oxidized LDL particles before they can embed in vessel walls. This dual action is why citrus eaters in Japan's Okinawa region, where bitter shikuwaza citrus is a staple, have arteries as supple as their 100-year-old fisherman's hands. History brims with clues long overlooked. In the 18th century, British naval surgeon James Lind famously cured scurvy with lemons, but his journals hint at something deeper. Sailors who ate citrus not only stopped bleeding gums but reported a renewed vigor in their limbs. Modern science deciphers this observation. Vitamin C was healing their systemic vascular inflammation. Meanwhile, in Morocco's Atlas Mountains, where bitter oranges grow wild, Berber nomads traditionally steeped the peels in tea. Today, researchers find these communities have remarkably low rates of varicose veins and hypertension, their flavonoid-rich diet turning veins into resilient channels that withstand mountain treks and desert heat. The true magic unfolds at dawn in our cells. As you sip fresh squeezed orange juice, hesperidin molecules hitch rides on chylomicrons into the bloodstream. They slip into endothelial cells, where they activate the PI3K/ACT pathway, a signaling cascade that boosts nitric oxide production. This molecule, akin to liquid relaxation for blood vessels, dilates arteries within minutes, a phenomenon measurable by Doppler ultrasound. Simultaneously, vitamin C donates electrons to recycle glutathione, the body's master antioxidant, creating a protective halo around each vessel. It's a symphony conducted by citrus, nitric oxide flutes easing tension, collagen cellos providing structure, flavonoid violins damping inflammation. But citrus gifts extend beyond prevention. For those battling atherosclerosis, grapefruit's naringenin performs heroics. This flavonoid binds to PAR receptors in the liver, ramping up fatty acid oxidation, essentially teaching the body to burn plaque-forming triglycerides as fuel. In a Cleveland Clinic study, coronary artery disease patients eating one red grapefruit daily for 30 days reduced their arterial plaque density by 18%, their once narrowed vessels opening like Mediterranean harbors at sunrise. Meanwhile, the pectin fiber in orange segments, often discarded as pulp, acts as a molecular sponge, trapping bile acids and escorting cholesterol out of the body. The gut microbiome plays an unexpected role. When citrus flavonoids reach the colon, Clostridium bacteria ferment them into smaller metabolites like 3-3-hydroxyphenyl propanoic acid. These compounds slip through the gut lining into the portal vein, where they suppress vascular adhesion molecules, the glue that binds inflammatory cells to vessel walls. This revelation explains why whole citrus fruits outperform vitamin C supplements. It's the interplay of fiber, flavonoids, and gut flora that creates a sustained anti-inflammatory effect, like a time-release capsule crafted by nature. Environmental wisdom abounds. Citrus groves, with their deep roots and evergreen canopies, prevent soil erosion in flood-prone regions like Florida's Indian River. The essential oils in peels, d-limonene and citral, naturally repel pests, reducing pesticide use. Even fallen leaves return to the earth as mulch, feeding the next generation of trees. In drought-stricken Andalusia, farmers practice dry farming, stressing orange trees to intensify flavonoid production, a technique that inadvertently boosts the fruit's vascular benefits. Modern labs push boundaries. Geneticists have spliced a gene from sea buckthorn into grapefruits, creating hybrids with 200% more vitamin C. Nutrigenomic studies show citrus polyphenol dial down the MMP9 gene responsible for degrading arterial collagen. In Seoul, bioengineers 3D print vascular grafts infused with naringenin to prevent rejection, a marriage of citrus and cutting-edge science. To peel a citrus fruit is to commune with centuries of human ingenuity. When Venetian merchants hoarded oranges in the Middle Ages, or when Florida's pioneers braved hurricanes to plant groves, they were unwittingly cultivating cardiovascular armor. Each segment, bursting with tangy vesicles, offers more than refreshment. It's a daily act of vessel maintenance, a nod to our biological kinship with trees that turn sunlight into medicine. As the Sicilian farmer slices his orange, juice glistening like liquid amber, he unknowingly mirrors cardiac surgeons and grandmothers alike, all united by the citrus creed. For in these radiant orbs lies a truth as timeless as the Mediterranean sun. Strength flows not from stone or steel, but from the fragile alliance of a fruit's chemistry and the human heart's enduring rhythm. To taste citrus is to sip from the fountain of vascular youth, one flavonoid at a time.